natural ways to lower cholesterol. That's what we're going to talk about. We know that the medical establishment is pretty obsessed with fixing cholesterol numbers, most notably the LDL cholesterol. And we, as three doctors, we share a similar mentality of wanting to have medications only as an absolute last resort. We as doctors would do everything possible to fix anything naturally if we could. So that's what we're going to talk about here, because we know that this is a very common problem. If one of us was diagnosed with high cholesterol and our doctor was suggesting that we consider a medication like a statin, what would we be thinking and what would we be doing to avoid being on a medication? For those of you who do enjoy our discussions, please check in the links down below, our separate, unique channel, Doctors of Ohio, where we post a lot of separate, exclusive discussions, all related to your health and well-being. So, Dr. Peter, as our cardiologist here, this is a good one for you. Let's get started on this topic.
Thank you, Suneel. And really, to start talking about cholesterol in general, we should just really know what it is. So cholesterol is part of the cellular makeup of most of the cells in the body. We've done prior podcasts on this before. But really, when is the last time you've been to your cardiologist or your primary care's office and they've really told you about the quality of your cholesterol? We're overly obsessed with cholesterol numbers being the lower the better or the higher the better, but that's actually not necessarily the truth. So when you break down cholesterol, you have your total cholesterol, you have your LDL, which is a bad sticky cholesterol. Think about that's the one that sticks onto the arteries. The HDL that's boosted with exercise is sort of like the dump truck that goes around the arteries and extracts it and gets rid of the bad cholesterol. Triglycerides is sort of in that gray zone where it's sort of the fat in your blood and it's really tied to blood sugar. But everyone always talks about LDL and the lower the better, but no one actually talks about the quality of cholesterol. And what do I mean by that? So we know that the makeup of your LDL and your HDL is so important because some people have high HDLs and still have heart attacks. Some people have high LDLs and you can have two people and one person has a heart attack and the other one doesn't. And so it's really about reducing inflammation and changing the makeup of your cholesterol because your LDL, if it's oxidized from inflammation, it's stickier. If your LDL cholesterol is made of large particle, it doesn't get into the arteries as easier as small particles. People always say HDL, the higher the better. We've all said it before. I've probably said in the past, but it's actually about the functional quality of your HDL. So when I talked about the HDL being that dump truck driving around through your blood vessel walls, if your HDL isn't functioning well, it's like that dump truck is kind of broken. So it doesn't matter how many dump trucks you have. So it doesn't matter necessarily if your HDL is really elevated if it's not functioning well. So if you have dysfunctional HDL, we're going to get into all the topics in a little bit about eating better, reducing stress, reducing inflammation, all boost the quality of your cholesterol.
Really well said. Thank you for that introduction. And we know that every single year, like with other topics we've talked about, blood pressure, medical authorities seem to be getting stricter and stricter. How do you feel, Dr. Ben, as a primary care doctor, firstly about this aggressive mentality of wanting to lower LDL? I know in the hospital, frequently doctors will say, well, we want it well into double digits, so below 70. Are you seeing a similar pattern in primary care?
Oh, absolutely. That's, I think, one of the main places you actually see it is in the outpatient world, in the primary care world or the cardiology world. You see that these guidelines and there's a lot of pressure to lower cholesterol as much as you possibly can. Now, we've talked before that there are dangers to lowering cholesterol too much. It's an important part of your cell makeup. It's an important part of your body. We very much need cholesterol. It's not in your body by accident. We've discussed that before. And I think Dr. Peter's bringing up a very interesting point about if you go on these medications and they change these numbers, but the quality hasn't changed of these different types of cholesterol, have you really made a big difference? Has something truly changed in your body that's going to protect you?
That's so true because you know that 30% of people who are on statins really haven't changed their diet. So in reality, yes, you've gotten the cholesterol number down, but the dietary component hasn't changed. So there's still inflammation. So you're right.
Yeah, and that's a really good point because we essentially, like with most illnesses, you're dealing with an inflammatory process. And I want to touch as well upon insulin resistance. which is by far now the number one reason for why people have high cholesterol, like with blood pressure, pre-diabetes, insulin resistance is upstream. And we're going to really focus on, now that we've given you a background on the process, the numbers to look at, as Dr. Peter said, the LDL, bad cholesterol, triglycerides, HDL, and the underlying inflammation and insulin resistance. Let's talk about the specifics now of what anybody can do to get their cholesterol numbers down. Not that you should be so focused on numbers, but if you wanted to do it naturally, how could it be done? And we'll start off with diet. So Dr. Peter, do you want to touch more on the diet aspect, which I know that you're very big on?
Oh, absolutely. So dietary strategies for reducing cholesterol all really focus around reducing inflammation. And we do know that a lot of the foods out there are really pro-inflammatory. These pro-inflammatory foods really change what I said before about the composition or makeup of your cholesterol. So it oxidizes it, which really makes it into just a stickier form. And that's probably a better way of thinking about it. So definitely reducing refined carbs, processed carbs, the seed oils, which are, a lot of them are ultra processed. It's not necessarily the oil itself. It's the chemicals like hexane and other things that the seed oils are processed with to refine them. So that's why for oils, it's always better to get cold pressed. So I think always just really the cleaner, the better.
Yeah, those are the devils of modern day eating, the processed foods, sugars absolutely everywhere, often hidden. You have to look at ingredient labels to see how this game is played.
It's such a challenge.
Yeah,
I mean, coming from Europe, and you can see supermarkets over in Europe compared to the States, we have aisles of processed carbs, cereals, you name it, we have it.
It's awful, yeah, all around us. And of course, unfortunately, the medical establishment is a little bit behind on this with regards to dietary focus areas. Right now, you will hear a lot of doctors, even cardiologists, still focus relentlessly on saturated fats, on salts. Of course, you don't want to have too much, if anything. I know, Dr. Ben, you have some thoughts on margarine, don't you?
Yes. Margarine is actually very pro-inflammatory. It is actually a very bad substitute. I would not be using that. It's funny because when that came about, that was marketed as a very healthy substitute for butter, and that butter was an absolutely hideous thing. Now, butter in very high amounts can certainly cause problems, but the idea that margarine, this kind of fake synthetic solution, is going to be good for your body was probably a bad idea to begin with, but now we've seen that margarine is very much pro-inflammatory and can cause a lot of these problems and certainly increase your cholesterol and cause other problems.
Yeah, it's remarkable that many of us grew up at a time where margarine was heavily processed. Put your hands up at this table if you would definitely go for butter instead of margarine. All three of us definitely pure butter, organic butter all the way. But that's not how people used to think. It's indeed not how people still think. What you want to remember with diet is eating a wholesome diet. Avoid, as we said, those fake garbage concoctions. Be very careful reading ingredient labels. Once you see it, you can't unsee it. And absolutely maximize protein, vegetables, antioxidants. But if you follow those guidelines, that should be a good step towards getting your numbers better if you can eliminate those. And I'm glad, Dr. Peter, you mentioned seed oils, which are everywhere.
Seed oils, the whole idea of like a low-fat diet is pretty much outdated at this point. I think we focus so much on that, and doctors still will hammer people about cutting back on all these fats, but it's actually really, the diet should be focused on cutting back on inflammation. And really, I think about almost the cholesterol issue as like a liver problem. And so it's really the connection with the liver. And so different foods and like alcohol and increased stress attack the liver. It causes dysfunctional processing of cholesterol. And so it's really not just, again, going at one number. It's about treating other things that lead to your cholesterol production.
That's right. Going upstream, which unfortunately the current medical paradigm is not good at. We're all about Band-Aids. And if you can think of this again as an insulin resistance reversal journey, you have to think, well, what foods are actually causing the insulin resistance? And nowadays, for the vast majority, it is the insane, unthinkable amounts of carbs, sugars, and processed foods. I really like the fact you said liver. So de novo lipogenesis is a process that converts all of these carbs and sugars into fatty acids. And then there's a vicious circle of insulin resistance and inflammation. Let's talk about exercise next. Obviously, another key component of the journey. Dr. Ben, you want to talk about exercise and how everybody can get into some better habits?
Absolutely. Exercise can be very intimidating. I think if you haven't started or it seems like it's a million miles away, you don't need to get to the finish line right away. So just start with walking, very small things in the beginning. If you're already exercising, great. But if you're not, just start with small exercises. That can be in your house. The beautiful thing about the internet is you can look up a ton of exercises you can do in your house. And I would say a good mix of strength. I'm not talking about bodybuilding, just basic strength is really great. Any kind of minimal resistance can be really good. And then just basic cardio. Start with walking, increase it more and more each day or each week, and you'll find you're really getting out there. I have people that weren't doing anything, but they slowly started walking. And after a while, they found, hey, I'm walking 2, 3, 4 miles a day. I mean, really big strides, but it took a while. But start today. Get started today.
I think that is fantastic advice. Just walk, if nothing else. Of course, you can do more, ideally do more, but walking is great. Too many people have fallen out of the habit of walking, walk at every opportunity. There's evidence that if you walk after meals, that is also really good for improving insulin sensitivity as well. I think it's fantastic for the brain. In fact, I have loads of ideas for making videos while I walk. I've told you guys this before. So I'm walking and then I'll suddenly have an idea. I'll get out my phone, put it in the notes section. Oh, this would be a good video. But I don't think this particular video was in that category, but many do. There's a little insider secret for you. Dr. Peter, strength training. I know you're big on this. So we've done the walking. How can people just start with some light strength training? Okay, everyone, I'm going to interrupt that awesome discussion for a moment to tell you about our expanding natural health and well-being store. We are very proud of our expanding store. We have natural immune inflammation support, bone support, memory support, heart support, sleep support, and our newly released premium organic lion's mane and organic chai mix. We've got some great reviews so far. Check in the links down below. ohighwellness.com if you're in the USA, North America, ohighwellness.co if you're in the UK, Europe. Also keep an eye out for our upcoming food and beverage products, including protein-thin snacks. All right, back to the discussion.
We know that two predictors of longevity that we've mentioned before is one is keeping lean muscle mass in regular exercise. So the power of walking, don't underestimate it. I always say it shouldn't be a source of stress. It should be a stress relief. You have to really find something you like to do. Walking is great. In my office recently, I got a treadmill that I put under my desk. So when I'm doing patient notes, I'm walking. And everyone in my office at first was laughing at it, but you know what? Now everyone wants one. So in reality, so with regards to strength training, so it's really focusing on core. And Ben, you had mentioned it. Really, it's not about going out and doing heavy weights because you're going to injure your back, but doing light weights, higher reps really not only increases muscle mass, but it has a protective effect on your back and your core. And we know that regular exercise lowers inflammation. And what you talked about, Suneel, is that walking after a meal can lower insulin resistance. And again, improving those quality of the HDL cholesterol, because we don't want it like a broken down dump truck. We want it like the dump truck that's picking up the trash, right?
Yeah, very good way of putting it. And I have encountered people who simply have started walking more. By the way, everything we're telling you, if you tick a lot of these boxes and you have high cholesterol because of insulin resistance, numbers can literally improve within a few weeks. It's absolutely incredible. I have known people who just simply walk more and their numbers improve.
Oh, yeah.
Their blood pressure improves as well. We see that all the time, don't we?
All the time.
Yeah, absolutely. So walking, and if you want to start with some light strength training, there are no excuses whatsoever. I always say this. I have seen people in wheelchairs literally use dumbbells, and maintaining a bit of muscle mass helps physiologically because muscle is very physiologically active with improving your metabolic health and reducing inflammation, also fat loss as well, because of course, this journey for many people is also a journey of fat loss. So please remember that. Walk, muscle strengthening, get some light cardio in as well if you can. Let's talk about natural supplements, which can help on this journey, because I know Dr. Peter, Dr. Ben, like me, you would do anything possible to avoid a prescription medication. That's not what we want. We're not saying it's always bad, but there are many research-backed supplements that can potentially really help on this journey as well. They won't be something that will just instantly lower a number, but remember, that's not our goal, to lower a number. It's to support that journey. Dr. Peter, you want to get us started?
Of course. So again, what it all comes down to is inflammation. So a lot of these supplements that we're going to talk about, and specifically going on to turmeric, is an anti-inflammatory. And it really calms down inflammation in the body, especially when it's paired with black pepper and the active component, which is curcumin. And so really that helps reduce inflammation. Reducing inflammation really changes the composition of the bad cholesterol to a less stickier form and the good cholesterol to a more functional form. Not to mention it can also help with joint pain. People sleep better. It's a whole positive pattern.
Yeah. Oh, turmeric is a big one, my favorite, for a variety of different supportive measures. And this is also backed up with research. There have been some studies on cardiovascular health as well. Any other specifically for this particular purpose? Because turmeric is broad all round,
Turmeric is
amazing. And if we're talking about for supporting the cholesterol and sort of heart journey.
Probably the one that most people hear about the most is red yeast rice. And so
Interesting.
red yeast rice is a fermented form of essentially a natural producing statin. So after it's fermented, it has the sort of similar properties of some of the statins out there, specifically lovastatin, which is a prescribed medication, but it's a more natural way. So it is effective. It's often used in patients who have really been crippled by statins from CoQ10 deficiencies and really just these myalgias or muscle aches. So CoQ10 is one that does help, along with, as well as the one we just talked about, but also berberine is another one. So berberine is a plant alkaloid, and it really just helps the metabolism of the liver and breaking down cholesterol. So those are probably two bigger ones that come to my mind as alternatives to getting your cholesterol down.
Interesting. So red yeast rice and berberine. And I've seen some research there as well, specifically for this potential benefit. I've also encountered a lot of questions over the years about omega-3s, cod liver oil. Research is kind of equivocal. Of course, remember, with any natural compound, you're never going to get the properly funded studies. That's never going to happen. But I've seen some evidence that there can be benefits of omega-3s. Have you seen that as well?
Omega-3 fish oil, there is benefit. When I use it, it's usually when people have elevated triglycerides. So your triglyceride is that fatty composition of your blood, and really when it gets too elevated. So if that number would be above 500, that's in a danger zone where you can be at increase of pancreatitis, which is inflammation of the pancreas, which is a horrible thing. So omega-3s can help lower that.
Got you. Okay. Let's think of another one, which I know you are big on, Dr. Ben, vitamin D.
Vitamin D is one of my favorite supplements you can take. Vitamin D levels are an important thing to be checking with your doctor. I would always make sure you're getting checked. They're often low as the winter months begin to hit because it's made from the sun. Actually, it's made from cholesterol, believe it or not. Vitamin D comes from the sun. Its rays hitting your skin, and the cholesterol turns into vitamin D. So vitamin D supplementation can be very important. It can decrease inflammation. It can strengthen your bones. It can increase your immunity. So it helps the immune system. And again, it decreases inflammation. So it probably helps with this whole process as well. But vitamin D supplementation is, definitely one of my favorites.
Very important to remember that because everybody knows that vitamin D is the bone vitamin, but it has got an array of benefits for metabolic and immune health. In fact, during the pandemic, one of the studies that I liked the most, which came out because there were many studies which, of course, I didn't like and were very questionable, but one in particular showed that low vitamin D produced much poorer outcomes in people who got the virus, and that makes perfect sense. A couple of other notable mentions which I want to talk about in terms of this particular journey and supporting cholesterol lowering. There have been some interesting studies on flaxseed and green tea extract as well. So feel free to look those up, and we'll make another video another time because this is such a big topic, and I don't think that this research, it's, as I said, never going to be funded properly, but these are all natural compounds. We're not talking about something like a statin, which will give 10 or 20% of people a side effect. It's something which is natural, which can be very supportive as you're doing everything else. So let's talk next about another crucial part of this journey of lowering inflammation and insulin resistance. Because, of course, most people know that you have to check the boxes of diet, exercise, but other parts of the well-being journey are not talked about anywhere nearly enough. And I want to talk about the role of stress. Of course, easier said than done, but I do know, Dr. Peter, you've got some thoughts on how stress can devastate the cardiovascular system and worsen inflammation.
Of course, stress is really the more scientific way is to talk about cortisol secretion in the body. And we know that most major cardiovascular events tend to happen during high periods of cortisol spikes and high levels of stress. So early morning hours, big cardiovascular events don't tend to happen during business hours. And really it's the increased stress, increases cortisol, increases inflammation in the body, which again damages arterial walls, it damages liver, it damages the cholesterol and making it more of a dangerous type of cholesterol. So you can see how everything we're talking about is really just connected, which is actually quite fascinating.
Exactly. And Dr. Ben, you see a huge connection with stress, which you've talked about before in primary care.
Huge connection with stress. Now, I always tell patients, it can be involved in multiple conditions that can be pretty devastating. And what I always tell patients is you can't control the events that happen in the world. So the stressful events that are going to happen in your life are going to happen. And the stressful events that are going to happen in the world are going to happen. But what you can control is the way you react to them. And it's not something you're going to be able to do all of a sudden. It's something you learn to do over time. So if you can slowly learn coping mechanisms to deal with stress and practice it, it's like any other skill, learning to deal with stress. The bigger stresses that come, you'll have a better way to deal with them. And so that's an important thing to practice, is come up with ways that you are able to deal with smaller stressful events. So when the big ones come, you've at least got some weapons in your arsenal.
Wow, that was amazing. You could be Emperor Marcus Aurelius himself, the great Stoic there. Absolutely, that's Stoicism right there. Learn to distinguish between that which you control and that which you can't. I actually enjoy in the hospital having these discussions with patients because I can't tell you the number of times. Every doctor will be able to tell you this, well, those doctors who actually ask, but how many people will tell you when you delve into the history that they've been extremely stressed and then they'll fall off a cliff. They'll get this horrible infection. They will have a cardiac event and they will admit that they've been insanely stressed and getting more inflamed. And it's easier said than done. It's all very well. We know this to say, let's manage stress. But when you're in that situation, it's tough. And if you want to look at it from a scientific level, what can you do for 30 minutes, even every day? Just take your mind to a better place, whether it's an intense workout that works for me to relieve stress, whether it is meditation, whether it's enjoying time with family and friends, your favorite comedy show, a walk in nature. Just get those cortisol levels down, and then hopefully you can address those sources of stress. And in fact, if you all have any stories to tell and share in terms of stress and risk factors for illness, because we hear it all the time. Actually, one that comes to my mind a lot is shingles. I talk to people all the time who will say they've had something horrible happen, like a bereavement, and they'll get shingles. And that shows right there that there's a definite link with depressed immunity.
That's super common. I actually see that a fair amount. Sometimes shingles comes out of the blue and people get, an outbreak, but so many times it's correlated to something very stressful and they go, oh, geez, here it comes. I had a good friend in medical school who was so stressed out about the tests, he got shingles on his head, and very painful. But he actually did some work to learn how to control his stress, but absolutely can be correlated. I see that all the time.
It just shows how increased cortisol, it's a setup for people getting sick. So when you say, well, I just caught a bug from someone, it's actually not that. It's the increased stress over a period of time is really just destroying your immune system. So you're already a setup for having a depressed immune system. It doesn't happen overnight. And so it's really, it's just so important.
Oh, it is, yeah. And I actually saw some research once. I'll have to dig up this particular study that stress is actually a worse risk factor for a cardiac event than having an elevated cholesterol level. Absolutely. I can believe that. Yeah, cortisol. And I've also seen some research that when people will go on a vacation or get their mind to a better place, their cholesterol numbers will improve, like blood pressure. So the fact that this is not stressed more, what a pun there. It should be stressed more. I should be a comedian, right? Yeah, that's amazing. Where did that come from? But it should absolutely be stressed more. by the medical establishment that stress is a big risk factor.
It really is. I mean, mental health and physical health are so tied together.
Yeah.
And in the years I've been a physician, that sort of just so ties close together. And so it's so important to you're never going to be able to get rid of stress. It's all about how you manage stress. And I think that's kind of the things that we just talked about. So
exactly. All right. So massive one to consider right there. I want to talk next about sleep, because how many people out there are not sleeping enough, and people are chronically sleep deprived, and this is going to absolutely impair the journey towards improved inflammation and insulin resistance. I know you both have something to say about that. We've talked about this before, so toss a coin. Who goes first, gentlemen?
Dr. Ben, you can talk.
So a lack of sleep is certainly going to cause stress, which we just talked about why that's so bad. It can also lead to inflammation, but don't forget during sleep, that's when a lot of the repair occurs. So that's when a lot of repair of your system occurs. And, people that have very, very poor sleep, we can see cognitive issues as time goes on. You can see early onset cognitive issues like dementia with people that have very, very poor sleep for prolonged periods of time. So it's an incredibly important phenomenon that occurs, and it can be very hard to achieve good sleep. And we've done multiple videos about how to do that and how to improve your sleep. But yeah, it's a really important risk factor.
You're right. Well said. So sleep is such an important part in repairing inflammation. It's your time when your body reboots. And without that, we know that people who get less than 6 hours of sleep a night have increased risk of a major cardiovascular event like heart attack or stroke. So it's just more than getting a good night's sleep. Your body needs that time for this at the cellular level too, to repair inflammation. It's like a computer. If it's not turned off, once in a while it just needs to reboot, right? Otherwise it just doesn't work as well. And we've done another podcast before, we talked about like nightmares during sleep too, which can increase or decrease longevity, which is fascinating. It all ties into cortisol levels. And sleep is it's such an important part of just reducing stress as well. And that's really just all ties back to cholesterol, because again, all this leads to increased inflammation. Increased inflammation leads to worsening of cholesterol.
Yep, it does indeed. And everybody knows their own sweet spot for sleep. And like stress, I've met people before who make this a priority and their parameters improve because it's all that inflammation which is settling down. So whatever way you can, make sure that you have a good amount of sleep. That's the key part of the journey.
And what are some good ways to do that? I mean, I think that melatonin is something I've always enjoyed taking, and I usually take it with something called L-theanine, which really helps calm the mind down, and melatonin makes you fall asleep easier. And then if you wake up in the middle of the night, which a lot of people, that's the problem, is when you wake up, melatonin tends to let you fall asleep a little bit easier.
Yeah, it does. Melatonin is great. Magnesium glycinate. Coming back to melatonin, you saw on the news recently that questionable link to heart issues. And it always amazes me because this was in the mainstream media. And you see this time and time again. They've tried to do it with turmeric. The mainstream media will take something which is natural and they'll produce a very questionable study. And it is absolutely very questionable. Even if you read it, of course, it was in the usual mainstream media, New York Times, etc. And they even say in the study that there's no link proved, but they've already put out the headline.
Sensational media.
It's sensational media, but also one which they will never say anything about the powerful pharmaceutical medications, which are causing so many problems, but they'll pick on melatonin, which all three of us take intermittently as well. Like millions of people take it. And they'll produce this sensationalist headline. So we're absolutely not buying that. Of course, you have to make sure that you're not having excessive amounts of anything, but this is a very natural compound, which has been used for a long time.
Well, your body makes it.
Your body makes melatonin as well. So really bizarre, the things that the mainstream media chooses to cherry pick. So yes, absolutely a lot of natural sleep supplements out there. Other things you can do, make sure you have a winding down routine. Don't have a room that's too hot. Don't eat or drink. Be careful with alcohol late in the evening as well. That can impair your ability to sleep. I do want to talk about one last thing because we covered a lot of pillars here in terms of how to reduce your cholesterol numbers naturally, assuming as it is in most people, it's due to inflammation and insulin resistance. And that is a benefit of time-restricted eating or intermittent fasting. Very, very powerful tool. And I've made videos on this topic before. If you can get to a 6 to 8 hour eating window, obviously go gradually, listen to your body. That I find is fantastic. Many people not only lose a lot of body fat, but their numbers will dramatically improve because their insulin levels are kept low. So they'll eat from, say, noon to 6 p.m. and then be fasting, time-restricted eating the rest of the time. You've seen some evidence on that as well, haven't you?
Absolutely. I practice myself. I feel better when I don't eat regular. We're all drilled in that we have to have breakfast, lunch, and dinner. I'd rather focus on eating good quality food at certain periods of time of the day. And that certainly works for me. And I always advocate it for my patients as well.
Yeah, I actually think it's complete nonsense that anybody has to eat 3 meals a day. Of course, everybody can pick what to do, but the same mainstream media and establishment that will sell you pills like statins are also telling you to eat multiple times a day. But that is not how our ancestors used to eat. I practice the same thing, and I don't use it for fat loss. I know you don't use it for fat loss. It's purely for metabolic health, resting your metabolism. And I couldn't have imagined it 2 or 3 years ago, but now I will go like the whole morning, and then I'll eat around 12 or 1, and then my last meal will be 7 or 8, and then I'm fasted the rest of the time.
So much better.
Yeah, oh, absolutely. So fasting can be very beneficial indeed for metabolic health, even in people who don't even want to achieve certain goals. But I've seen a lot of benefit in people who want to improve those parameters. All right, let's finish with closing statements then. As 3 doctors who personally would do anything to avoid a prescription medication being on a statin, let's talk about our summary of this topic, what we would be focusing on, either your top thing or top 3 things. Dr. Peter.
Treat your body as a whole. So you've seen through this whole talk that we haven't really just linked it just to one number. We've talked about a whole array of things, but everything that we talked about, whether it's sleep, exercise, stress, you name it, really ties back to not only your heart health, your metabolic health, but also the topic of this video is obviously cholesterol, and the quality of your cholesterol will be better. So you just have to treat your body the best you can because no one else will except you, right?
Yeah. Well said, Dr. Ben.
Well, I think you can see after this talk that cholesterol management is not just taking a pill. It's not just one simple thing, but as Dr. Peter said, it's taking care of your whole body, and it's doing the things that we know about, right? So it's being careful with your diet, it's exercising regularly. There are a number of supplements you could consider to help you along your journey. It's minimizing stress and getting good sleep. All of these things that we know improve your health, believe it or not, improve the cholesterol as well, of course. So do everything you can to avoid these medications. There are synthetic compounds that go in your body. You do not want them if you can avoid them, and this is the best way out.
Yep, absolutely. And I will second both of those awesome pieces of advice. I would, if I had that high cholesterol diagnosis and I knew that my metabolic health wasn't where it should be, well, I would say this. Everybody can improve, even people who think they may have good metabolic health. There's always things you can do to improve. We all have slip-ups every now and again. I would absolutely focus on the diet. I would introduce time-restricted eating. I would have a more structured strength training routine. I would optimize natural supplements in any way possible. I would try to sleep enough. And all of these things together can hopefully help move the needle in the right direction. But as with anything, it's always a discussion with your doctor. We are presenting you with our thoughts, and depending on what your numbers are, and we've made lots of other videos, we will link one to this about specific numbers and what we think about the current recommendations, etc., and what doctors have been doing. But it's always a choice. Everybody must know the benefits and risks if they are presented with any medications, and everybody who is so inclined can always be thinking, what can I do naturally to improve the situation? Because I guarantee you, even if you're the best athlete in the world, there's always something you can do if you want to go up a step on the ladder. All right, everybody, thank you for watching. We do appreciate it. We are cheering you on. We want you to succeed in every way possible. We know that it's tough out there. It's a tough medical system. It's tough to find good doctors, especially if you want a metabolic health focused doctor. We wish actually there was a magic list out there of doctors across the country in every area. We often get asked that question a lot. Unfortunately, no such list exists because it's not many doctors who are really thinking outside the box, but we're hoping that that will change with time. But we really want your success. Your success is our success. Again, please feel free to comment down below, share your stories. Do you have anything else that you think is also beneficial? Share with everybody down below. Check in the links down below as well for our natural health and well-being store, ohighwellness.com. If you're in the USA, North America, ohiwellness.co. If you're in the UK, Europe, we have a lot of exciting new additions to that, including our organic chai mix, which we got a lot of good reviews for. All three of us just had a cup of that tea as well. Maybe it helped us relax. Who knows? Take care, everyone, and we will surely speak again in the next show.